Is the pain in your back originating from your SI joints or your lumbar spine? Most people don't know, and even many doctors, that there's a simple test that takes less than 30 seconds, doesn't need special training or equipment to perform, and is quite accurate in helping to determine if the SI joints are the cause of a person's pain. Why a test like this is so critical is that if you don't know whether your pain is originating from your lumbar spine or your SI joints, you can spend weeks or months going to doctor's visits, trying different therapies, and getting frustrated while remaining in pain. Understanding the source and cause of your pain is critical to you getting out of pain. In this video, I'm going to teach you what this test is, how it works, and share with you how it's performed. To start though, I want to explain why tests like this are so important in the first place. I don't know where you're watching this video. I know there are viewers from all over the world, so I can't speak to everyone's healthcare experience. But here in the USA where I live, our healthcare system can many times be scant on doing the simple things to get a proper diagnosis in back pain cases. While doctors are apt to order x-rays and MRIs, simple things like a really thorough orthopedic examination are often missed, and that's unfortunate. I want to share a classic example of this that I see over and over to illustrate why this test is so important to determining if someone is suffering from SI joint pain. This case involves a young man in his 30s who had suffered with 2 years of right-sided low back pain that came on while doing heavy deadlifts in the gym. He'd tried many things to get out of pain without lasting results. He'd seen some of my videos, and even though he lived in Germany, he came in to see me. Shout out to Tim if you're watching. Tim had pain right here on that right SI joint low back region that had been there for a couple of years, and it was made worse by prolonged sitting, bending forward, and also when he contracted his muscles to arch his back like this. He had seen an MD, gotten imaging, and was told that there was nothing wrong in his imaging. He was sent to physical therapy, and that didn't provide lasting relief. He continued in pain and really wondered, at age 30, if he was going to have to live his life with this pain in his lower back. He was also left wondering, is my pain coming from my SI joint or my lower back? The x-rays he had didn't show any cause for his pain, so he was confused. And I find that many times patients come in to see me feeling exactly that same way. It's not uncommon. Before I teach you the simple test I did with Tim to determine if his pain was coming from his SI joint or his lumbar spine, I want to answer a question I frequently get from my patients. The question I hear regularly is, my x-rays and MRIs came back with no real findings, and yet I am experiencing real pain. What's going on? What a frustrating situation that is for someone. It might sound familiar. To help my patients understand how this can happen, I share this analogy. I want you to think about your cell phone. Your cell phone is made up of hardware, like the screen, the computer board, battery, and the hardware needs to be working properly and be undamaged for your phone to work. But your cell phone also has software, things like the operating system and the different applications. If the software has bugs or needs to be updated, then even if your hardware is undamaged and working properly, your phone is going to be glitchy and not work properly. X-rays, MRIs, and CT scans, they look at hardware, not software. They look at structures like your bones, muscles, tendons, and ligaments to determine if they are damaged or not. And your hardware can be undamaged, and yet you have daily pain. What I find is that humans, just like their phones, can have software problems. Certain muscles can be inhibited. Joints in your body can get fixated or stuck. Myofascial adhesions or scar tissue can limit your normal motion and send incorrect signals to your brain. Faulty movement patterning can cause you to load your tissues in a way that produces inflammation and pain. In the case of the SI joint, the ligaments that support the SI joints can be more stretchy than they should be, leading to instability across that critical pelvic joint. This ligamentous instability does not usually show up on X-ray or MRI, and yet it is a real cause of pain that requires a solid physical examination to uncover. Now back to Tim and the simple test we did to help him understand what was causing his pain. The test I'm going to show you is called the SI belt test, or the Adams supported belt test. It should not be confused with the Adams forward bend test, which sounds similar. That test is looking for scoliosis in the spine. The SI belt test is an orthopedic test. And while the term orthopedic test might sound intimidating, all orthopedic tests are designed to do just one thing: to challenge a tissue in the body to create or relieve discomfort or highlight abnormal function. This test is based around relieving discomfort by creating stability across the SI joints. Before I show it to you, a few words of caution. YouTube is amazing, but it is a one-way medium, and I can't see you or know what you're going through. You may be a championship college athlete, or you might be 87 and limping around with a cane. So before I show you this test, I want to say that this video and test are not a substitute for seeing a doctor. There are many things that can cause back and SI joint region pain. Some of them are more serious than others, but the care and knowledge of a doctor is critical to make sure that red flags are not missed. My intention with this video is that you learn that this test exists, how it can help you easily identify if your SI joint is the cause of your pain, and give you a tool that you can ask your doctor about to help you get a proper diagnosis and treatment. I can't stop you from trying this test at home, but if you do, these two things are vital. This test involves doing a standing forward fold type of maneuver. And if you're having trouble bending forward due to severe pain, instability, or other limitations, then don't attempt it. And to do this test, you need a strong volunteer. Do not try and do this test with someone who is not strong enough to counteract your weight and help you stabilize. Falls are no good. Lastly, because I want you to be able to get this test performed by your doctor, I've included a one-page handout describing this test with pictures that you can bring to your next doctor's visit and discuss. You can find the handout in the video description down below. Like I said before, this test is going to help us differentiate if it is our lower back tissues, like our lumbar discs, low back muscles, facet joints, ligaments, or our SI joints that are the key source of our pain. To do that, we start with having a person standing and ask them to bend forward like they're going to touch their toes. And while I routinely teach people to hinge from their hips and not round at their lower back, this is a time where I want a patient to bend from their hips and their spine. When we bend over like this, we're not only bending over from our lower back, but also our SI joints. With this first part of the test, the standing forward fold, I really want to know if there's any discomfort or pain. If so, really pay attention to three things: where the pain is, the quality of the pain. Is it sharp, achy, pulling? There's different ways to describe pain. And the intensity of the pain. Try to get some metric around the level of your pain. If you do not have any pain or abnormal sensation with bending over like this, then this orthopedic test is not going to be of value to you. There's a whole cluster of tests we can use to diagnose SI joint pain issues, so it might be that some of those are better suited for your specific case. But if you do have pain or discomfort when bending over in a forward fold, and the pain is coming from your low back or SI joint region right here, the next step of this test is for the doctor to stand behind you with the side of their hip against your sacrum. They will then place their hands on your ASIS bones. Those are the bones right here on the front of you. And they're going to pull in against your ASIS bones as you slowly bend over into forward flexion. You're going to notice one thing right off. You're not going to be able to bend over as far. And that's because now you are only bending from your lumbar spine and not from your SI joints or hips. If your pain stays the same or gets worse when you're being supported while you bend forward, because we've isolated the lumbar spine tissues, the problem is more likely to be coming from your lumbar spine and not your SI joints. Things like lumbar disc problems, lumbar facet irritation, or low back muscle strains. However, what is often surprising to my patients like Tim is that if the problem is coming from your SI joints, then many times the pain you felt when you previously bent forward will now be significantly less, or often is completely gone. This is because the SI joints are being stabilized in this position. With the results from this test, you and your doctor will hopefully have a better understanding of whether it is your lumbar spine or SI joints that are causing your pain. And understanding what tissue is the pain generator is fundamental to being able to deliver the appropriate and most effective remedy. If the SI belt test reduced your back pain and you think you might have an SI joint pain issue, then you might find this video to be helpful. In it, I talk through how the SI joint works, how it can get injured, and things you can do to get relief at home. SI joint pain can be stubborn, debilitating, and often misdiagnosed. So educating yourself can really help you to get the care you deserve. As always, thanks for watching, and until next time, take care.